My name is Delaney. I will be talking about the lack of ASL interpreters for deaf people at hospitals. Those two sentences are what I just signed, except I used American Sign Language, which many of you may not be familiar with. What you just experienced, having no idea what someone is saying and having no way to communicate with them, is a small taste of how many deaf people feel when they have to go to a hospital. Now imagine that confusion amplified by not being able to hear or often communicate effectively, doctors and nurses rushing around talking over each other, and being sick, injured, or otherwise incapacitated. Unfortunately, this is what many deaf people go through when they have to go to a hospital. Many hospitals either don't provide live ASL interpreters, it takes hours for one to arrive, or they rely on often faulty video interpreting equipment. For my performance, I will be performing the section of the Americans with Disabilities Act that requires hospitals to provide an ASL interpreter for deaf patients, with 3 news articles about deaf patients who are not provided an effective interpreter and suffered through harrowing hospital experiences. I'm terrified to go to the hospital in these situations. People who are deaf or hard of hearing use a variety of ways to communicate. Some rely on sign language interpreters or assistive listening devices. Some rely primarily on written messages. Effective communication is particularly critical in healthcare, where miscommunication may lead to misdiagnosis and improper or delayed medical treatment. A few days before Christmas, they starved Mark for 24 hours. That's standard procedure before an endoscopy. They didn't tell him that's what he was going to have. As far as he knew, they just stopped feeding him. Then, when he was due to have the endoscopy, it was delayed by a few hours, so his hunger went on, and no one told him why he was being starved until he figured it out for himself when the time had come. He didn't give his consent for it, that's for sure. Under the Americans with Disabilities Act, hospitals must provide effective means of communication for patients, family members, and hospital visitors who are deaf or hard of hearing. The ADA applies to all hospital programs and services. Wherever patients, their family members, companions, or members of the public are interacting with hospital staff, the hospital is obligated to provide an effective communication. The chest pain was bad enough. Then John Paul Jebian asked staff at Baptist Hospital of Miami for an American Sign Language interpreter. They instead brought a video screen with an internet link to a remote interpreter to help him understand what the doctors and nurses were saying. Jebian, who is deaf, said a nurse struggled to set up the equipment as he anxiously wondered whether or not he was having a heart attack. I was panicked. I didn't know if I had to have surgery. Everything was going past me. I didn't know it was happening when it was happening. Exchanging written notes or pointing to items for purchase will likely be effective communication for brief and fairly simple face-to-face conversation. Written forms or information sheets may provide effective communication in situations where there's little call for interactive communication. For more complicated and interactive communication, such as patients discussing the symptoms with medical personnel, or a physician's presentation of diagnosis and treatment options to patients or family members, it may be necessary to provide a qualified sign language interpreter or another interpreter. With the minutes ticking by, and staff still unable to operate the video interpreting service, the hospital turned to another option. For the next 6 hours or so, while undergoing tests and hooked up to IVs in both arms, Jebian said he wrote notes back and forth to the doctors with his limited English. He communicates primarily through ASL. He is lying down in a hospital bed with his arms out, so he couldn't even see what he was scribbling. I wish I had 4 arms at the time. They were saying, "Oh, I'm sorry, I can't find your vein," while I'm trying to write them notes, trying to guide them. Situations where an interpreter may be required for effective communication. Discussing a patient's symptoms and medical condition, explaining and describing medical conditions, tests, treatment options, or surgery, having a diagnosis and recommendation for treatment, obtaining informed consent for treatment. I was furious, upset, and a bit traumatized. I felt really alone. She said she frequently felt isolated and unsure why she was getting certain injections or what exactly her medical status was. Both times, it took 3 to 4 hours for a trained interpreter to arrive in the emergency room. Later, in the hospital, she was unable to schedule an interpreter to meet with her doctors. During her multi-night hospital stays, her primary means of conversation was to scribble back and forth notes with her nurses and doctors. Hospitals and other medical providers have no idea how frustrating and dehumanizing it is for deaf and hard of hearing patients when they're forced to, for example, write back and forth notes about their stroke symptoms, lip read the doctor who's about to perform surgery on them, or be told by their family member, not the doctor, that they had a heart attack. For my performance, I chose to cite guidelines stated in the Americans with Disabilities Act in comparison with news stories about deaf people who received unfair treatment at hospitals. I used the sections of the ADA that discuss hospital protocol for deaf and hard of hearing patients. Then I intertexted that with 3 news stories of deaf people who are not provided with effective interpreters and experience marginalized treatment at hospitals. The patients included a 46-year-old man named Jebian who was admitted for chest pains, a 67-year-old woman named Ellen who had a stroke, and a man in his 50s named Mark who required an endoscopy as well as other medical procedures. Despite ADA guidelines, many hospitals across the country are guilty of neglecting the seminars that are supposed to teach them how to set up video interpreting equipment, and some hospitals lack the equipment altogether. This is an issue that is vastly underreported on and more prevalent in our society than most people realize. According to the Centers for Disease Control and Prevention, an estimated 37 million U.S. adults have hearing trouble, ranging from partial loss to complete deafness. One of my performance decisions was to choose a topic that is not very well known or frequently discussed in our society. I tried to make my voice more compelling and put more emotion into the parts where I read as a deaf patient to differentiate it from the ADA segments. According to MacDonald, performing literature is one way of doing public discourse. The photo I chose for my background is taken in a hospital in China to show that this issue is prevalent all over the world. The image is of a doctor holding up a note for a deaf woman who's about to give birth. I wanted to give everyone a visual of how difficult it is for deaf people at hospitals that don't provide interpreters. I hope that my performance will make people more aware of the marginalization that deaf people experience and remind them that no one should have to receive inferior treatment just because parts of our healthcare system are not well equipped to care for them.